Welcome to Dr. Pam Unleashed, where we skip the gimmicks and get real about what helps pets actually thrive. I'm Dr. Pam, functional medicine vet, symptom decoder, and your guide to a vibrant, no BS pet care. Let's get into it. Welcome back to Dr. Pam Unleashed. This is part of our mini-series, Gut Check, where we explore your dog's gut, the single most important factor in your dog's health. I'm Dr. Pam. In our last episode, we talked about the 5 things that the gut controls: immunity, behavior, skin, energy, and longevity. Everything leads back to the gut, period, full stop. Today, we're diving into the warning signs that most people miss, the progression from subtle changes to serious disease that your vet isn't connecting. Let me explain. Your vet looks at a dull coat and says, it's cosmetic. Skin issues? Here's a steroid. Food intolerances? Try an elimination diet. Inflammatory bowel disease? Here's another drug. Autoimmune disease? Let's manage this with immunosuppressants. But here's what I see. These aren't separate problems. They're stages. One can lead to the next, which can trigger the next, which can compound into the next. It's a cascade. Here's the empowering part. If you understand the progression, you can stop it before it becomes devastating. You can catch it at stage 1 or 2 instead of stage 5. That's what we're talking about today. So let's walk through how gut failure actually shows up, from the very first subtle signs that most people completely overlook, all the way to what happens when the immune system gives up entirely. Stage 1, the subtle early warnings. This is where it all starts, and I'm going to be real with you. Most people miss this completely because it seems, minor. You start seeing changes in your dog's coat. It's not as shiny anymore. The color is fading a bit. There's less contrast, like someone turned the vibrancy down. You might notice that the nose isn't as black as it used to be, or the pads are looking grayer than that gorgeous black you had as a puppy. Most people shrug this off. He's getting older. It's just his winter coat, or that's normal, right? Let me explain what's really happening. This is a huge indicator that your dog is not extracting the nutrients from their food to feed the cells. Either the diet doesn't have enough nutrient density, or they don't have the means to extract it, or maybe a little both, which is most commonly the problem. Remember what we talked about last time. Aging is deficiency in motion. This isn't normal aging. This is your dog's body sending up the first flare. I saw a perfect example of this last month. Calvin, a young border collie, beautiful dog. As a puppy, he had a really rigorous case of hookworms. They were persistent and he kept getting reinfected. Now, that tells me his mucosal immunity at the gut level was already compromised. He got multiple rounds of deworming agents, which, by the way, can change the entire course of the gut health. Fast forward to now, and his coat is telling the whole story. If you spread his hair and look at the base, especially towards the back end of the body, the hair is coming out of the skin lighter, kind of dusty looking. Definitely not that glossy, deep pigmented coat you expect. The texture went from that silky border collie perfection to almost wiry. His nose, instead of looking like a piece of shiny black coal, has a brown-black appearance, and is not quite as glossy. His pads, which should look like Italian leather racing gloves, are now medium gray and just a little bit rough. His owner keeps saying, but we're feeding him so well. And they are the best whole food diet on the planet. But he's too skinny. He can't put weight on. Here's the thing. Feeding well doesn't matter if the body can't extract the goods. This is stage 1, gastric biochemistry insufficiency. I talk about this a lot in my practice because dogs are becoming more and more deficient with each generation. And if you ignore this, here's where it leads. Stage 2, skin issues emerge. So stage 1 brought you here. Now the immune system is starting to get involved. We talked about the gut-liver-skin pathway in the last episode, so I won't go deep into that again. But here's what's happening at this stage. Those nutrient extraction problems from stage 1, they're not getting better. The cells aren't being fed, and the gut is getting leakier. So things that should be going out the back end are now getting absorbed into the bloodstream, creating absolute chaos. The immune system shows up to deal with all of this chaos. Meanwhile, the skin itself is not being nourished. It's no longer supple and soft, and it becomes dry, itchy, and easily traumatized. Then comes in more itching, which leads to lesions, which leads to infections, which leads to your vet prescribing antibiotics, which leads to further messing up the gut. And here you are now in this vicious cycle. You know what's fascinating? Once skin issues start, they rarely stop on their own. The cascade just continues like the Energizer Bunny. It just keeps going and going and going. And here's where I need to get on my soapbox for a minute. I'll stand on that soapbox and do a backflip off of it if you'll listen to this. Do not, I repeat, do not vaccinate your dog during skin issues. You're pouring gasoline on the fire. Skin issues are at the beginning of immune dysregulation, and vaccines are potent immune stimulators, right? That's their whole function. At this point, vaccines will push you straight into the next stages faster than you can imagine. I know this might be a bit controversial. I'm the vet who gets worked up about vaccines, but there's a time and a place for everything, and during a skin crisis is not that time. Okay, stepping off the soapbox for now. Let's keep going. Stage 3, food intolerances multiply. Here's where things get really frustrating for pet parents. People hate skin allergies more than they hate cancer. I know it sounds weird, but it's true. Skin issues are in your face every single day. The itching, the licking, the gnawing, the hair loss. It makes people feel helpless and mad because they can't control it. So they start trying things. They stop feeding chicken because they read somewhere that it's the most allergenic protein. And hey, it gets a little better, but then it gets worse again. So maybe they cut out beef. Maybe they do a food intolerance test and find out that their dog is intolerant to a couple of foods. They adjust the diet, but they're not treating the core issue. Want to know the crazy thing? I've seen people repeat that very test a year later after trying everything that it said, only to find out that their dog was intolerant to literally everything else on the test. Here's an interesting fact. Food intolerances are not allergies, they're intolerances. With the right treatment, a dog can get past them. With the wrong treatment, they multiply. I call this allergic to life. And yes, it may sound extreme, but when you see the results on the test, it's totally accurate. The level of reactivity is a sign of serious microbiome dysregulation when there's so much inflammation and chaos at the gut lining that the body can't tolerate anything anymore. I saw this happen with Brody, that gorgeous Doberman I mentioned last episode. His Nutri-Scan test was so dysregulated, he was allergic to virtually everything except for a couple of exotic proteins. It made feeding him, well, kind of interesting. But the good news, he's turned the corner because we addressed the gut issue. The gut lining at this stage of the process is so compromised that the body is reacting to everything. And if you keep just chasing the symptoms instead of addressing the gut, here's what happens next. Stage 4, inflammatory bowel disease. Remember Calvin and his dull coat back in stage 1? Without targeted treatment, this is where ignoring those early signs can take you. IBD, also known as inflammatory bowel disease. IBD is basically a label vets use when there's a collection of digestive symptoms, but they can't determine the cause. Here's what it really is. You're now closer than you realize to full-blown autoimmunity, where the immune system attacks the body. Dogs at this stage might have upper digestive issues, vomiting, regurgitation, belching, gas, or lower digestive symptoms, soft stools, multiple bowel movements, even when they're formed. They can't tolerate food, or every protein on the Nutri-Scan is lighting up. I have a doodle named Cooper. I love this boy, but he's one of these cases. And you know what? Sometimes you can't roll things back without trying traditional medicine first to stabilize them. Cooper actually needed that. I sent him to an internist friend of mine to get him stable while we started working on rolling back the health clock. At this point, we sometimes need those drugs as a bridge just to calm the fires enough that we can start rebuilding. With Cooper, we're now using something called low-dose naltrexone. This is a functional medicine treatment for immune regulation. Most traditional vets don't even know about it, but it's been a game changer in this prequel to autoimmune disease, and for autoimmune diseases themselves, for that matter. It's a staple in functional medicine practices around the country for humans and is building steam in the U.S. for pets. Here's the reality check. By the time you're at IBD, you've missed years of early warnings. Years. You can trace the whole path backwards. Dull coat led to skin issues, which led to food intolerances, which brought you here. Each stage may vary a bit, and some pets are more severely affected than others. If this continues unchecked, there's one more stage. Stage 5, autoimmune disease and cancer. This is complete immune system failure. Let me explain. You can trace this entire journey: coat changes in stage 1, skin changes in stage 2, food intolerances in stage 3, IBD in stage 4, and now the immune system has completely lost its ability to regulate itself. Immune-mediated thrombocytopenia, autoimmune hemolytic anemia, pemphigus foliaceus, cancer, because what is cancer but cells dividing out of control because the body's regulation systems have failed? I have a patient right now who illustrates this perfectly. His name is Brady. His case breaks my heart, but it also fires me up. Brady has pemphigus, an autoimmune skin disease. He's got behavioral issues as well. Shocker. Adrenal dysregulation. I have the microbiome panel to prove what's happening on the inside. In this case, it's a microbiome collapse. The dermatologist he was seeing used so many different drugs that his entire microbiome collapsed. Building up the microbiome when it's been destroyed by drugs, it's incredibly hard. You have to get off as many of the drugs as possible just to create an entry point where healing can begin. It is a delicate balance. And dermatologists cling to their drugs like Velcro. We often say sometimes knowing what to do isn't helpful if the person holding the leash won't do it or if another practitioner is working against you. I know what Brady needs, but I'm stuck between a dermatologist who won't let go of steroids and other drugs and open up their mind, as well as a client who is desperate to recover Brady's health. Currently, we're using ozone therapy to kill off the pathogenic bacteria, eliminate biofilms, while attempting to fortify his gut flora as much as the drugs will allow. We're starting LDN, low-dose naltrexone. I'm actively working on getting his dermatologist to decrease the drug use so we can actually get in there and help him. Oh, and by the way, if you vaccinate a dog at this stage, game over. I'm serious. Because here's the truth. When you have a microbiome collapse, you're not long for this world. You need to move on the path of healing like you have never moved before. We almost lost Brady once when the rabbit hole of pharmaceutical intervention got extreme. And now I genuinely worry that with these drugs on board and a resistant dermatologist, we might face another crisis that will be unbelievably hard to come back from. So now you know. The 5-stage progression, your vet isn't connecting. Stage 1, coat and pigment changes. Stage 2, skin issues emerge. Stage 3, food intolerances multiply. Stage 4, inflammatory bowel disease. Stage 5, autoimmune disease and cancer. Here's what I want you to understand. This is a potential progression, not a certainty. Where your dog ends up is in your hands. If you catch it early, you can stop the cascade before it even gets started. You don't have to end up at stage 5. This is about pattern recognition. You can see those subtle coat changes in stage 1 and actually do something about it. And if you recognize it at a later stage, get aggressive, jump in and start treating the underlying issues. You can reverse the progression. I've seen it happen. I've done it. The difference between a dog who progresses through all 5 stages and a dog who stops at stage 1? Action. Understanding what you're looking at and doing something about it. In our next episode of Gut Check, I'm going to show you the testing that changed everything for my practice. a new microbiome panel that reveals not just the bacterial populations, but fungal populations and the nutritional needs as well. It gives us a clear roadmap of what's actually happening in your dog's gut and how to fix it. No more guessing. Until then, look at your dog and ask yourself, what stage are we in? Because recognizing where you are is the first step to stopping progression. Don't forget to download your pocket guide for this episode from Hero.fm app. It's called Recognize the Progression of Gut Failure Before It's Too Late. It's got the 5-stage progression mapped out so you can reference it at any time. This is Dr. Pam, and I'll see you in our next and final episode of Gut Check.